All right. Hi, everyone. Welcome back to the Arm Hug podcast. For those that are new here, we basically interview subject matter experts in entrepreneurship, healthcare to try to inspire you guys a little bit about starting your own business. And today I have an incredible guest. I met her at the D4AS conference. If you guys have never heard of it, it's a Diversity for Alliance for Sciences. And she has an incredible company and a really great product with a lot of experience. So I want to introduce you guys Sandra Shpilberg. She's the founder of Adnexi, and she's going to walk us through with how she got started and tell us a little bit more.
Great, excellent. Yeah, I'll start there. Hi, everyone. So I started my career in accounting, actually, on Wall Street, and I spent a few years there before deciding that I wanted to pursue my MBA and switch to the healthcare industry. And I was really attracted to the healthcare industry because I wanted to be involved with products of high utility, knowing that at the end of the day, there was somebody on the other side that really needed whatever it is that we were working on, right? Whether it's a new medicine or a new treatment or a cure or something of that sort. So went to Wharton to get my MBA, and I interned at Genentech during my summer. And that was my first experience in biopharma, biotech, and also on the commercial side of the business. So so that was a great experience. And then after I graduated from Wharton, I went off to work at Johnson & Johnson, the Centocor division, worked there for 3 years, then moved out to California and worked at BioMarin. BioMarin is a rare disease drug manufacturer that back then was a small company, small, medium-sized company. And I spent 9 years there launching 2 products and bringing another one from phase 2 to phase 3. So that was an incredibly formative experience. Wow. 9 years, launch experience, product development experience, clinical trial experience. And then from then I went to a small company, Nora Therapeutics, where I was there for a year. The company was developing a phase 2 drug in the women's health area, and they were running into issues recruiting the clinical trial. And that's when I came up with my first idea for a business, which was to apply digital marketing to the process of finding patients for clinical trials. And again, this was in 2015, quite a while back when digital marketing was more nascent. So I started my first company, Seeker Health, which was a patient finding platform. And that company grew rapidly. There was an incredible need to find patients, especially patients with rare diseases, patients with complex conditions, with cancer. And that was the focus of Seeker Health. And so that company grew, and around year 3, I started getting acquisition offers. And so I decided to sell the company. I sold the company to Eversana and then completed my time there in 2020, and then turned around and decided to start a new company, Adnexi. And all the companies that I have founded, basically, they are after solving a problem in biopharma. It is a problem that I have seen firsthand. For example, with Seeker, it was the recruitment of patients for clinical trials. With Adnexi, it is the identification of key opinion leaders, the building of those relationships that are fundamental to the business of biopharma. So just to back up for a second, as biopharma develops new drugs and brings those new treatments to market, they don't do that alone. They need to have a very well-defined stable of what they call key opinion leaders. And key opinion leaders, they are physicians, researchers, and scientists who are experts in that specific disease, and they will become involved in the work of biopharma throughout the entire development process. In phase 2 or phase 3, there might be clinical trial sites. Later on, they might get involved in publications, they might get involved in speakers bureaus, they might get involved in patient education. And so it is very important for biopharma to be able to identify who these key opinion leaders are and be able to start building those relationships. Those relationships take time to build. And one of the common, I think, myths in the industry is that you just need to know the top 10 or 15 key opinion leaders in any specific disease, and then you'll be set. And nothing could be further from the truth. When you put together all the different tactics and strategies that biopharma is going to run, they need to know hundreds of these key opinion leaders, and they're going to be needing to develop these relationships. So what does Adnexi do? A couple of things. One, we help them discover who are the key opinion leaders for any specific disease. Two, we help them measure the influence of that key opinion leader, because just because somebody published, 100 papers on the disease, they may or may not be influential to their peers. So we help them measure that influence. And three, through the use of our software, we help them track that relationship. Help them note, who is interacting with this KOL, what has been the historical relationship that has been formed with this particular key opinion leader. So that's Adnexi, and we've been in business for 3 years. Company is growing. And as you know, last week at the Diversity Alliance for Sciences, I had the opportunity to present the company, and we won second place in the Eight That Innovate competition.
Yeah, congratulations. I know that was so exciting to see that. I guess like for me, I'm thinking a little bit about what kind of questions I get a lot from people who are probably trying to do the same thing you are. What makes you different besides, I guess, the KOLs you mentioned? You did talk a lot about building relationships, and it does take time. Is there any way to measure when the relationship is going the right way?
Yeah, that's a great question. Like, how do you measure if the relationship with a KOL is going the right way? I think the ultimate measure is if you send them an email or call them and they respond. That's the measure of a relationship, right? Is there is there reciprocity there? Do they want to be working with you? But in order to build that relationship, it's built over time, right? And biopharma companies have a lot of different procedures that they do to actually build these relationships. Normally things start with there's a confidentiality agreement that's signed. Maybe there's some sort of advisor agreement that's signed. Maybe this key opinion leader is invited to an advisory board. Maybe then they're invited to a publication board. Maybe they're invited to be a phase 2 investigator, or a phase 3 investigator for a clinical trial. So the relationship gets built primarily by collaborating on important activities that have meaning, that are critical for the biopharma company, while also are critical for the key opinion leader in terms of helping them build a career.
That's a great idea. I think your company is a great idea. I think also it's very much needed. So a lot of people listening here are probably looking to start something or are in the process of it and have been struggling. And most of the time it's finding support and finding the right people to talk about to help solve a problem, right? Because you're absolutely right. You can't grow it all by yourself. There comes a time where you really do need expertise. So are there requirements or qualifications to become an expert on your platform, or can you talk a little bit more about that?
Yes, yeah. So our process of discovery for key opinion leaders takes a couple of different forms, I would say. So one, we access massive data sources like PubMed, clinicaltrials.gov, open payments. We collate all this data to figure out who has the profile that we're looking for. And a profile for historical KOL is generally somebody who has published quite a bit on the disease. They have maybe had some clinical trial experience in the disease. Maybe they already serve as an advisor for another biopharma company. So we will collate that entire profile based on public data. It's public data, but it's immense data sources that we need to process and then aggregate into individual profiles. So that's one way to look at it. The second way to look at it is that we want to understand the influence of these particular KOLs. Just like I said before, just like because somebody has had all this activity that they have done, they may or may not be influential. So for that, we get our own data. We create our own data where we go to get this information. We get influence data directly from peers. We process that data into these beautiful interactive maps where we've gotten incredibly great compliments from our customers in biopharma. And then the third form that this takes place is that some key opinion leaders are not the historical key opinion leaders, but they are digital. They are doctors who get in front of a camera on YouTube, on TikTok, on Instagram, and talk about the disease. And they generally share very little in common with the historical KOL that has 100 publications and 10 clinical trials under his or her belt. but they're influential in the sense that they have a channel where they're sharing information about the disease, and they have followers, generally patients with the disease that are watching the content that they're producing. So we also identify those types of KOLs. So a lot of what we do is data processing, getting lots of data to be able to create profiles and then rank those profiles for biopharma so that biopharma can aim their efforts where the KOLs that matter most are going to be.
And is this by a subscription, or just curious, like if you're new to learning about your platform, do people just jump online, maybe talk to somebody first?
Yeah, this is biopharma, so it's more like a B2B type of sales model. They usually would talk to me or somebody in our BD area, and then we would understand exactly what they need. Yes, there is a subscription to our platform, and our clients pay that subscription annually to gain access to the data that we have. But in addition to that, we also do a lot of specific projects where we're going to go get specific information that they're looking for at any given time. So it's a mix of both service and then also software as a service on its own. In terms of what we do that's slightly different than many other companies is that we tend to customize our platform for the specific customer. So we are not an off-the-shelf software product. We're a customized software product, which means that if company A wants to have these 3 buttons here because that's what's important to them, that's what they will get. And if company B wants something different, that's what company B will get. So the customization is a very important part of what we do and what we offer in terms of the value.
Yeah, that's amazing. I guess I have a question a little bit about the people you're servicing, like you mentioned, are biopharma, which they're probably servicing, I guess, in the long run, the patients all the way at the end.
Yes.
Do you find that it's more difficult to get in touch with them than, let's say, a patient who might be interested in, or let's say a clinician that might be interested?
Yeah, I mean, I think, biopharma, generally, these are small, medium, large companies. So yes, there are some difficulties in getting access to them for sure. And I think that that's generally one of the things that I focus the most on. How do we get good access to these companies to show them what we have? At the end of the day, they're the ones that need to consume the type of data that we have. It's most important to them in terms of aiming their efforts. So, patients might be able to get something out of our platform, but we don't at this point have a patient-facing offering. And doctors might also be able to get something out of our platform. But again, at this point, we don't have a doctor-facing offering. We are sort of following where there is sort of like a need, like an intense need to have this information, which at this point is really with the biopharma company.
Yeah, no, absolutely. It makes sense. I myself had to learn a little bit when I was working with clinical trials. And I think that, yes, getting in touch with the people who, whether it's like you're the principal investigator or the person that was involved with, I want to say, approving a lot of the things that we had to do beforehand, whether it's an important executive or a doctor that was too busy running around in conferences or not being able to pick up calls, maybe not even seeing your email because their mailbox was loaded with mail. So the idea of them ever seeing your email, it's lost. So thank you for developing this, because I think it's going to help a lot of people and communicate better with people that we really, really need to get their attention.
Yes, exactly.
So I'm curious a little bit about how you feel your background has helped you start the company. Like, was it you feel like a decision you felt that you knew that you were going to do something in biopharma and you wanted to start another business?
Yeah, so I've always felt I've been very entrepreneurial. And if you look at the biopharma companies that I worked at, I went from large to medium to small to very small. So generally always looking for that more entrepreneurial stage where things are being built and it's exciting and innovative and somewhat risky. I think that that's always been an interest to me. So my previous background helped tremendously with both of the companies that I have started, because both of them are servicing biopharma, right? So I came from biopharma, and now, in biopharma, I got the opportunity to identify some of the problems they're facing, some of the things they're doing manually that they could be doing with more technology, some of the things that they're doing without any technology that they could be doing with some marketing technology. So it's really sort of like my time in biopharma was absolutely necessary to, one, understand some of the problems that they're facing, to understand what matters to them, right? What is the end goal, and how do you develop an end-to-end solution that's actually going to help them? And then three, have some connections to go back to and say, here's what I'm developing. What do you think of it? Do you have any feedback for me? Do you want to try it, right? So those connections were really incredibly important. I think without that, those 15 years in biopharma, it would have been much more difficult to create my first company for sure, and this one as well. So that time really helped. And I still rely on a lot of the connections and a lot of the knowledge that I built back then to build the company I'm building now.
Yeah, thank you so much for saying that. I get a lot of questions about where do people find customers, or where do you look first? And really, it's within your network. So, yeah. I mean, there's a great example of someone who's using their network to continue to push their company forward, their ideas forward, because in a sense, you're not only making the solution for the people you know, but also the people you previously met. So
yes, and ideally you get a customer out of your connections, but there's something else that you can get before you get a customer, which is feedback. And feedback is really important as you're developing a new product. You want to understand if this is really going to fix their problem, if they would use it, if they have any ideas on how to improve it, if it creates any other problems for them that we should try to solve before putting this out there for other people to use. So yes, ideally, at the end of the day, from your connections, you get a paying customer. Beautiful if that's what happens. But in between nothing and getting a paying customer, there's the opportunity, really valuable feedback. And many times that's how I've approached it. I've approached some of my connections saying, I want to show you what we built. At this point, all I want is some of your feedback, right? Let me just get your feedback, and then they'll see what you're building. And then if they see a use for it, they might, eventually become a customer.
Yeah, or refer your services, because now you've put them in your network, right? You're top of mind, and they're like, oh, wait a second. I think I know somebody who can help you with this. That's how it works. I have to ask, what does Adnexi mean?
Adnexi is a made-up name. I made it up. I wanted the company to start with A. Okay. I wanted it actually possibly to end with I, since there's so much AI out there. But it stands for Advantages for the Next Generation of Patients. That's what we're after. We're after innovating to realize an advantage, AD, for the next NEX generation of patients. So Adnexi.
I like it. Yeah, no, it has a ring to it. So I was like, I wonder what it means, or is it an acronym, but love it. So I'm curious to know a little bit about, since we've been talking a lot about biopharma, I wanted to move over to your entrepreneurship side, because you have so much experience in that. You previously started another business. So can you talk a little bit about that? Like, you were able to start 2 within your lifetime, and many people struggle to start any.
Yes. So let's see. My first company I started in 2015. I was leaving a biopharma company. So I was at a tiny biopharma startup that had failed their phase 2 studies. So the phase 2 studies had failed. The company was going to shut down. And I had this decision point to make. Should I go get another job in biopharma, or I just had the opportunity to see this company struggle through patient enrollment and try to patch together some digital activities that were patched together? Is there an opportunity to build a company where this isn't a patch, but it is by design a digital marketing campaign for clinical trials? And so obviously I decided to do the second. There were a few things that helped me, of course. One is that I had a little bit of a landing from the previous company where they were going to give me some severance for a couple of months. So that helped. So that I looked at those months of like, well, I'm getting paid anyway, so I might as well experiment on this. One, I had a husband who was working, right? And I by then, I wasn't, I'm an immigrant, but I was okay financially, right? So I think that those are the things that many times stop people, because if you need a paycheck, right, to come in every 2 weeks, a paycheck may not come in every 2 weeks for the first few months that you run a company. But I did decide to start my company as a service, right? So that was one of the important things with Seeker, that we started by providing marketing campaigns for clinical trials. And that was a service that I could provide without necessarily having to develop any of my own technology, because the technology had already been developed by Facebook and Instagram and Google. And so I was going to use Facebook and Instagram and Google to customize campaigns for clinical trials. Now, they required incredible customization. So there was a complete value add that was added there by our company, because we had to figure out the way through for a clinical trial to be able to advertise on these social platforms. So what's the lesson there? Whenever you can start a company and find some sort of way to bring in some income, that is really good. Then after being a service company, we evolved to become a software company and build the software, had enough money to build the software and to really scale from there. So I think that was one of the things that really helped me back then. But in any case, going into entrepreneurship always feels like a leap. You're literally going from something to the complete unknown. You're creating something from scratch. And it is normal that it feels like a leap. I mean, I think that is both part of the excitement, part of the risk, and part of the fear, probably for a lot of people. It is a leap into the unknown. You don't know what the outcome will be of this creation. But I do believe that if you show up and you do your homework, you figure out the way through, you listen to what your customers are saying, you perfect your service or your product over time, you will have something. And the experience itself would have been incredibly rewarding.
Yeah, no, and I agree with you. It's like it sounds so organic. So I'm curious, did you have investors help you along the way? Did you think about that?
I did think about investors, but I decided not to raise venture capital for Seeker. And so far for Adnexi also, we are not raising venture capital. And the main reason is that we have, at this point, sufficient revenue to do what we need to do to grow the company. That may change at some point. So in general, I think venture capital or other types of capital are really needed. One, if you need to develop a product and it costs a lot of money to develop that product before you can bring it to a customer that will pay. Or two, if you want to have that additional funding to grow the company much faster than maybe you would in some other ways. Now, the capital doesn't come for free. It comes with people who sit on your board, people who have control over the company, and generally people who will get paid first at the time of an exit. So while I think in the area that I live in, Silicon Valley, it's very celebrated when people get venture capital. It is money that comes with significant strings that need to be understood. Now, it could be the right funding strategy for many companies, especially companies that are heavy on technology and have the opportunity to capture a very large market.
Yeah, I agree with you. So, and I also, I commend you for not taking it if you don't need it. That's not something that people feel comfortable saying. So that's awesome. And it's okay to not want to feel that you need to get investors right now, but maybe in the future, it might come along and the right opportunity steps on your plate. I'm curious to know a little bit about you mentioned when you were talking about boards and when I mentioned investors, like there's obviously going to be people sitting at the table that are not you making decisions. When you mentioned key opinion leaders, is that who you're thinking of? People who would help people make better decisions?
Yeah, I think a key opinion leader for a biopharma company plays that role. They generally play the role of advisor. They play the role of executor. They execute the clinical trials, they execute a publication strategy, they execute a speakers bureau strategy. So they're definitely, I think the key opinion leader is best defined as a partner. They're partnering with biopharma to accomplish goals that at the end of the day are hopefully going to do a couple of things. One, get this treatment to the patients that need them as fast as possible. And then two, ensure that patients, physicians, payers out there have the information that they need to make a decision on this treatment.
Right. Yeah. And I think in healthcare, we have that barrier, right? Where it's like, we need to find the right people for this answer. And it's like, but there's a bunch of data we need to look through. So either we have time to look through that data or we just make a decision now. So I think a lot of people can really relate to what you're talking about. And it just shows you that where you worked, it doesn't need to be that way all the time. That's what we're here for. We're observers, but we can also help solve some of these issues. So
yes,
that's amazing. And now I want to talk a little bit about your like personal and business work balance. How was that like when you first started thinking about entrepreneurship?
Yeah, I mean, a company requires a lot of attention, right? I wrote a book about seeker health. The book is titled New Startup Mindset. Chapter 2 is about single deep focus. And then chapter 8, I believe, is about burnout, right? So companies require the founder, the CEO, the key people to be focused on that company. Like that focus, that attention is really the air that a company gets to keep breathing on. So it is really important to be able to be in a period of your life when you are able to devote that type of focus to the company that you're building. But at the same time, you are your own person, and building a company is going to take a while. So I wouldn't want to put my entire life on hold while I'm building the company. I still need to be able to grow as a person, do the things that I want to be doing, have the fun I want to be having, have the relationships I want to be having. Like, ideally, you're not putting your entire life on hold because, building a company can take 5, 10 years, 15 years. I mean, it's impossible to really know how long you'll be involved in the company, but what you know is that it's going to be a while, right? And so in that while, it's really important that you're still doing the things in your life that you want to be doing, number one. But then number two, that you're taking care of yourself, that you're not burning yourself out to a point where you can't show up the next month to the job because you burnt yourself out, right? So I think that balance is really important. And, it just depends for people, like what they need. I mean, I know for me, I need sleep. Like sleep is super important to me. So it's not something I'm willing to compromise. 8 hours a night, I measure it. If I'm behind, I catch up. This is like super important to me. Food and nutrition, super important to me. I notice a complete difference if I'm well nourished and I'm eating my vegetables and my fruit and my lean proteins versus when I'm not eating that way. Exercise, obviously, super important. We, a lot of the work that we do for our startups is sitting in front of a computer or going on a plane to visit somebody. And so that needs to be offset with like some good movement that happens in the body. So that's for sure. And then fourth, and probably like most important, is like your inner self, your person, like your soul, your whatever you want to call it, right? Like that thing inside of you, that is the true you, and that needs to be fed. And so whatever feeds it, is it reading books? Is it going to festivals? Is it hanging out with friends? Is it whatever it might be, right? You have to do some of that while you're building your company. You cannot put it on hold.
100%. I love that. I love it. All right. So last question for you, right? Any advice you have for someone who's probably too scared to, take that step or still thinking through it and, seeing how big the players are in healthcare and how regulated it is. Like, it's not just tech, it's people who really want to do something for, whether it's the drug company that helped them with a cancer treatment or that clinical trial that helped them with figure out something new about themselves. Like, it's amazing where people get inspired to start healthcare businesses.
Yeah, I mean, my advice is the first thing is find a problem that is worth solving, right? And that you feel like you can solve this problem in some specific ways, right? Because at the end of the day, what companies are doing is they're solving problems. They're not just sort of like coming up with solutions that don't have a problem.
Absolutely.
Right. So ideally, what you're doing is, like I did in my previous companies, is find a problem. Right. My company was struggling with clinical trial enrollment. The women that they were looking for were on Facebook talking about their disease, seeking information, and so try to see if you can find some sort of problem that then can be fixed with some either technology or some solution that you put together, some product, some service. So I think ideally that would be my advice. While you're doing that, make sure that you stay very connected with your potential customer, right? So you want to be getting feedback. You want to be understanding if you were to do XYZ as a solution that becomes a company, would they buy that? Would they be interested in that? Are there any reasons why there are massive barriers to getting that type of solution used by your company? Are there other people that have already come up with a solution, or they come up with like 60% of the solution, and therefore you need to have something that's better than what they're doing or different? So I think that that is sort of the work that needs to be done in the beginning. But ideally, the advice that I give people is if you've been having sort of this whisper inside of you that says, I want to start a company, I know this industry, I know people, my advice would be start. Like start, take the first step, then the second step will appear, and then the third will appear. But the third step can't appear until you've taken the first and the second step and committed that you're going in this direction. So I think my advice would be to start, but obviously I don't want to say just start. You do have to have an idea of a problem that you're looking to fix, and you have to have some ability to say, I am in a position to understand this problem and be able to design a solution for it.
Yeah, that's amazing. Thank you so much. I think that everybody listening can probably agree with me that it's just great to hear when people are so passionate about it and they're doing it. And you are basically just showing up, like you're saying, like you said, showing up and people are seeing it. And I think that that's already saying like, oh gosh, she's committed it. She's doing it. She's out here striving
Yes.
for her star goal. Okay. Well, Sandra, I can't thank you enough for taking the time today to do this. This helps people realize a little bit more about what they want to do. And I think we need more entrepreneurs in healthcare. So this also is one of those things where you're giving back. So thank you so much for stopping in. And I hope you guys check some of her work out. I will put her links below this video so that you guys can go and see what she's up to, maybe learn a little bit more about her company, maybe refer it if you know somebody who's looking for something like this. And thank you so much. So I will continue to be connected.
Excellent. Thank you. It's great to talk to you.